One of the most common things that we see at our office is sciatic pain or sciatic sensitivity or sciatica for that matter. And generally what's causing sciatica is typically some form of, whether it's a disc bulge or a disc herniation, or maybe just with normal aging, we're starting to get some narrowing of the foramina in the spine. And what's happening is we're getting compression of that sciatic nerve and we're starting to get some pain that travels down the back of the leg. And this can replicate itself as sharp shooting pains down the leg. It can be a burning sensation, tingling, numbness, or oftentimes we'll find a hamstring is just significantly tighter on one side in comparison to the other. And so what happens is we get these sensations, and the general consensus is we want to stretch it and we want to tug on it to help loosen it because we think it's tight, when oftentimes stretching it doesn't really make it better. So if you've been stretching something for weeks to months and you're not getting any change, it's more than likely not a tight hamstring. You're probably getting more neural tension that's coming out of the low back. So the way that we fix that, or the way that we approach that when we start care, is we use nerve mobilization or sciatic nerve mobilization rather than hamstring stretching. And so the way we do that is we want to take the sciatic nerve. We want to imagine it is just one long unit that travels down the leg, connects to the spinal cord, and goes up the back. And what we want to do is we want to take that whole nerve and we just want to slowly start to glide it back and forth, whatever is causing sensitivity, whether it's that disc or it's the foramina, or sometimes with acute low back pain, we'll get an inflammatory reaction that's in the foramina. We can help kind of draw some of that inflammation out of the spinal cord. So the way we do that is we have our patients first start by sitting, and typically with low back pain, this is a fairly uncomfortable position, especially if we let ourselves slump forward, correct? So we're looking to find a comfortable position where we're not really reproducing much pain. Mild discomfort's okay. It should not be torture. It should not be extremely painful. And we'll find that comfortable position. The leg that is bothering them, so the leg that we're getting sensitivity or pain or tension in, we're going to kick that leg up, draw our toes to our chin. As the leg comes up, we're sitting up and we're looking up to the ceiling. So our head and our foot are moving together, and then down, kicking the leg up, head comes up and down. Kicking the leg up, head comes up and down. And see, the idea is here, rather than stretching the muscle, we're moving that nerve root and we're trying to apply motion to the nerve root and flush out inflammation and desensitize it. This shouldn't be painful. Like I said, if this is making it worse, it's probably not the right exercise for you. A lot of patients do get some benefit when they start. So give it a shot, see if it helps, and let us know if you have any questions.